Let's paint a picture together. You're a child growing up, maybe living in your third state since your military family moves around a lot. But you can't do some things with your dad, like play your video games too loud because he can't handle loud noises. You can't jump out from behind the couch during hide and seek to surprise him because he's going to yell at you. More and more as you grow up, you start to understand what's happening. You start to understand what your dad is saying on the phone, something about the VA. His counselors aren't calling him back. He can't be seen. And if you're like me, that story's true. And if you're like some other kids who had it worse than me, your veteran parent committed suicide because, well, the VA was booked and there was no other way out. My name is Casiple, and today I'm sharing my research answering the question of what can be done by the Veterans Health Administration to increase the timeliness of post-traumatic stress disorder treatment for its patients. PTSD is defined by the APA as a psychiatric disorder that may occur in people who have experienced or witnessed a traumatic event such as a natural disaster, a serious accident, a terrorist act, or war or combat. This disease is a major burden on the public at large and among veterans who face a 13.8% PTSD prevalence. And for years, the VHA has been controversial for delayed treatment of its PTSD patients. Steps have been taken, certainly, and yet veterans are being treated by clinicians who feel cynical about their work, clinicians who feel little agency in their work with veterans, clinicians who feel fatigued. PTSD is already hard enough to treat, but clinicians face heavy workloads, and we see downstream delays in initial treatment appointments, which are critical for treating severe mental illness, including PTSD. Additionally, we see poor communication between the VHA and other care networks in their communities. Many VHA providers report that there are no established modes of communication with care providers based in their communities. So what can be done? I suggest a two-pronged strategy, the first of which involves revising the VHA's vision statement to reflect a commitment to strengthening relationships with community-based care. And in terms of actual care delivery, I suggest that the VHA and community-based providers can be held accountable to shared performance measures for PTSD care timeliness by mutually evaluating and facilitating process improvement in each other's care settings. So by leveraging already existing resources and making tweaks to how the VHA collaborates with community-based care providers outside of the VHA network, I think that the health of the VHA organization can be improved, which would thus translate to improved veteran health, faster initial treatment appointments, millions of dollars saved, and while it doesn't solve war, it can help solve the war that many vets fight when they come back home to reclaim their health. Thank you.